that would be great. If you want to turn your video off, or we'll just take a moment now before we begin. Okay, thanks. Thanks, everyone. As I'm sure you're all aware, COVID-19 has taken quite a toll on us as a society. We have a new way of living, and it just seems like every day there's something new that's coming out. And certainly when we started to hear about the coronavirus and its impact in Wuhan, China, and then starting around the world, I don't think any politician saw coming what came. And we were all very, very quickly put into rallying mode as councils, and certainly the federal government and the provincial government in responding. So I just wanted to kind of highlight what the town of Whitchurch-Stouffville Council has done in the response timeline. You'll see that on March 13th, we actually announced the closure of all of our town facilities, and really looked at starting the physical distancing and isolating regime that's really become the way we now live our lives. On the 24th, the town was actually one of the first municipalities in the province to host its first virtual council meeting. And that was really a strange experience. We had just a few members of council and senior staff in the council chambers, and other members of council were in other offices. Senior staff were in other offices, and we didn't realize at the time, but this would be the way that we were actually going to run business moving forward. On the 24th, the same day, I declared a state of emergency in the town following the declaration of York Region. There was a number of municipalities ahead of us that declared a state of emergency, but we wanted to be consistent within Whitchurch-Stouffville following the lead of York Region, and certainly the chairman's declaration on the advice of our medical officer of health, Dr. Kurji, who's on the call with us. And so we did that on the 24th. On the 25th, the town made a decision to defer tax and water bill due dates, which were due in early April, last week actually for most of them, until the 29th of May, realizing that the shutdown and the provincial orders that were coming from the legislature and the premier were having a serious impact on not only us as a community, but on you as residents. And we wanted to try and start a process of bringing some relief from a financial perspective to the residents of Whitchurch-Stouffville. On April 4th, following the order from the premier, we introduced fines for residents that were not adhering to physical distancing. And we started to release a number for YRP and bylaw that residents could call if they were seeing people that were not practicing, or they were not following the order. And we wanted to take an education approach for this. We did not come out of the gate fining people. Certainly, that's not the approach that we would want to take. We wanted people to understand the reasonings behind it. We had lots of people that were still using our parks, even though we had officially closed our parks 3 weeks earlier. But we got to the point where we really needed to actually have the threat of fines And that was unfortunate to do, but is actually worked out really quite well because our community has really rallied and are practicing physical distancing. They're only going out for essential reasons, which is going to the grocery store, going to the pharmacy, um, just trying to think. Oh, getting getting some physical exercise, practicing 2 meters apart from people. But the non-essential travel has really stopped in our community, which is great. Uh, on April 9th, we released our business continuity and economic recovery plan that was endorsed by council, which really helps us set a path forward for how we are going to deal as a municipality with recovering from COVID-19. On April 9th, the same day, we launched the Stouffville Community Care Network, which is a webpage off of the town website, which is set up to help connect people who are in need in our community with people that want to help. And if there was one thing that I have seen over the last 5 weeks is the spirit of generosity in our community shine through. People calling me, emailing me, reaching out, asking how they can help people that are in need. And we know we have a number of people in our community who, are at an at-risk age, our seniors community especially. And many of them are actually quite afraid of going into the grocery store. And so we had really generous people step up and help connect with people that couldn't get out or don't want to get out for fear of contracting COVID-19. So that's been a great resource, and we've had just an overwhelming response of people who've signed up for that. And on April 21st, which was on Tuesday, our town council made a decision that we were going to be reducing our water and wastewater rates. The York Region Council made a decision to actually hold 29 water and wastewater rates through the rest of 2020. And council reduced our rates to try and again help from a financial level the burden that many in our community are facing as they stay at home and are not working during this time. So that's kind of just a brief timeline of what we've gone through. I want to talk about the community support for a second. When COVID-19 kind of really took hold in our community, and there was a call out for PPE, which is personal protective equipment. We had a amazing resident in our town, Allison, who runs one-to-one rehab, reach out to me because she wanted to do something. And she knew that we had a 3D printer at the library and asked if she could borrow it because she wanted to make face shields for healthcare workers. And I was able to connect her with Margaret, who's the CEO of the library, and we took our 2 3D printers over to one-to-one rehab, and they have been producing face shields ever since. And on Monday of this week, I was able to deliver 30 face shields that were created right here in Stouffville to Buckingham Manor for their staff to wear as they care for the residents there. And it's just an amazing story of innovation and just, again, our generous spirit in our community and people wanting to help. As I mentioned earlier, the Stouffville Community Care Network was established, which is fantastic. And just the connecting people that need to be connected, which is great. PPE donations have been coming into the town, and it's actually overwhelming to see how many people have just stepped up to donate PPE for not only are they donating to Markham Stouffville Hospital, but they're wanting to donate to our long-term care centers and our seniors residences and to our bylaw and frontline staff with our fire services. So we just had 10,000 N95 masks dropped off today by a donor, which is just fantastic to see. And that will continue to happen, and we'll continue to distribute those in our community to protect our community, which is really great. And then I'm really excited to announce to all of you today that our Economic Development Officer, David Tooley, has been working tirelessly over the last 3 weeks to really figure out a way to help the business community in Whitchurch-Stouffville. And we have launched today a new website called L4A.ca, which is everything Stouffville. And that is now live, L4A.ca. So that's the first 3 digits of our postal code. We're one of the only municipalities, it seems, that has one prefix for all of our mailing area. So that's why we're all L4A. So you can go check out L4A.ca. It is a resource that shows about what restaurants are offering, health services, businesses. And I know that he's wanting to develop an online shopping portal, and he's investigating that for our businesses to try and help mitigate some of the issues that we've had, certainly with the closures and revenues being down. To support our local economy, council actually put out 2 ads last week in the Sun Tribune. One was for our Whitchurch-Stouffville Food Bank, which is servicing our community in need during this time. And I do want to encourage you, if you can support the food bank by donating not only food, but some money to help them, that would be a huge help. They're just an amazing group of volunteers that keep that place running, and they could use all the support that they can get. And so you can go to wsfoodbank.ca/donate, or you can drop off non-perishable foods at Metro and No Frills. They're open Monday and Wednesday from 9:30 a.m. until 12. And so it would be great for you to continue to support the food bank. And the other was an ad that we were open for business, and we wanted to do something where we could support our local economy and especially our restaurateurs downtown who have really suffered during this time. And many have had to get really creative and pivot very quickly from being a full service establishment to takeout only. And so we wanted to just promote our businesses. And so we ran an open for business ad promoting the downtown. So I want to talk now about our current statistics. And as of today at 5 o'clock, we have 21 members of our community who have contracted COVID-19. But we have 7 of those 21 that are fully resolved cases, which is actually something I think that we need to celebrate. Our numbers of COVID-19 cases in Stouffville has consistently remained low on average with the region. And I contribute that completely to the efforts that you, the residents, are making in practicing social distancing, washing your hands as often as possible. We are actually making a difference in what we're doing. And as I've said in many videos before, I know this is a huge sacrifice, but we're going to get through this together, and we're going to be able to celebrate together when this is over. And there was a week where we went without any new cases, which was just an amazing thing to see. And we've had there's only one new case since yesterday. So our numbers are still relatively low, and I do take a little bit of joy in that. I'd love to see there be no cases, and I'd love to see 21 resolutions, but I'm thankful that there's no hospitalizations. We haven't lost any members of our community, and I hope and pray that we won't do that. There are some really helpful websites and resources that are available to everyone. And so I want to just bring that up. If we can bring that slide up, that would be great. Our website, which is townofws.ca/COVID-19. We have developed and are continuing to develop this as a resource for you to get as much information as you need on how the town is responding. There is a great PDF that's been updated by David Tooley, our economic development officer, which highlights all of the federal and provincial responses, and has links to where you can go. So if you need to apply for funding of any kind, if you're a business owner, or if you've lost your job, or if you're a student, in the announcement that was made yesterday, you can go and find all that information on the townofws.ca/COVID-19. I want to draw your attention to the public health website that the region has put up, which is york.ca/COVID-19. This website is updated every day at 5 p.m. And so you can track along with the resources there. And I really encourage you to go and look. It's an evolving website. There's so much information that's there. And we're going to get into some of the questions relating to some of the information that's on there with Dr. Kurji in a few minutes here. Obviously, federal support is canada.ca, and provincial support is on ontario.ca. And I do want to draw your attention to the online assessment tool at ontario.ca/coronavirus. There's going to be lots of, and there has been lots of conversation around testing and symptoms, and whether, how do you know when to go to an assessment center? And doing an online assessment is probably the first thing that you should do if you feel like you might be symptomatic of COVID-19. And from that assessment tool, it will kind of tell you what you should do. Should you reach out to your physician or telehealth or public health and get direction on what to do? So this whole presentation this evening is being streamed and will also be made available on our Facebook page, facebook.com/townofws, I believe. And so you'll be able to get these links from there. So we're going to move into actually why we're here tonight, which is to ask some questions. And so if we can get out of the presentation mode, and I'm going to start lobbing some questions at Dr. Kurji. And then again, if you are on the Zoom call and you're interested in asking Dr. Kurji a question, you can chat to our moderator and let them know. And then when we're through, we have a number of questions that have been pre-submitted. We have some questions from members of council, and then we can open it up to the community to ask some questions. So Dr. Kurji, the first question is from Olivia, and she's asking, we had only 2 resolved cases for about 4 weeks. Why is this number unchanging? Is it a matter of not retesting, or does the virus take a long time to leave the system? I think you're muted still, Dr. Kurji. There you go.
Thanks. Thank you, Mayor. And thank you, members of council for Whitchurch-Stouffville, and I'm happy to be here. And thank you, Olivia, for that question. The correct answer to that is that we have been challenged with respect to putting in all the data into the integrated public health information system. I think it's fair for me to say that never have we experienced such a barrage of cases coming at us. At the height of it, I think we were getting about just almost 70 cases a day come at us. And right now, of course, we are quite challenged with respect to the numbers of outbreaks that we're experiencing in the region of York. And unfortunately, we don't actually have an electronic case management system that is just in the process of possibly being implemented as of next week. So there will be some challenges there as well. So when it comes to information management, we have had to do this manually. So the information that you may have with respect to individuals who are resolved cases isn't exactly the accurate information, largely because the individuals may have resolved, but the data hasn't yet made it into our systems as yet. So it is only in the last few days, and you will have noticed the numbers that have been resolved have really gone up to reflect the reality. We've still got some more that have actually got to be put in. So I guess in response to your question as to why is it that, these two individuals, may have not been resolved for a long time, the most likely reason is that they were resolved, but the data hadn't actually been entered.
Great, thank you, Dr. Kurji. The next question is from Matt. And the question is, the virus seems to affect each person so differently. When we hear of cases that are hospitalized versus those that can just self-isolate, are there always other comorbidities involved for those hospitalized? Or are there different variations of the virus out there, so some people get it worse than others?
Thank you, Matt, for that question. The virus is an evolving virus in the sense that our knowledge of it is evolving. And given that, in terms of the studies that were done in China, a simple comorbidity like high blood pressure would also result in serious outcomes. So there are many individuals that we see who are hospitalized and who may be in ICU who do have a number of serious morbidities. And that actually probably makes it much more likely that they'll have a serious and not such a good outcome. So let's not be fooled by this virus. Unfortunately, in the very beginning, it sort of approached us as something that just caused mild illness. But subsequently, we have discovered that it actually is quite a vicious and deadly virus that seems to be very smart and appears to be getting through our defenses, particularly into the homes. And so we are seeing all sorts of variations in terms of outcomes. For example, we've now had two individuals at long-term care homes who had no symptoms at all, but died because of the virus. And it was only found on postmortem testing. So I guess the point that I really wish to make is that let's not underestimate the virus. And certainly when one has comorbidities, the outcome is worse.
Okay. Thank you. The next question is from David. As the weather continues to gradually improve, I imagine there will be more people exercising outdoors, jogging and cycling. I was wondering if you recommend that outdoor exercisers wear masks to limit respiratory droplet spray transmission, as I believe that the droplet spray radius is much larger for joggers and cyclists. So Dr. Kurji, there's obviously been lots of questions about wearing masks out in public and why it's a good thing. And certainly the federal government changed their position on wearing masks outside. So maybe you could speak a little bit about that for us.
Sure. So the issue of masks, again, is something that people may be changing their opinions on. More recently, we at the Region of York have been looking at this very carefully. And we have generally aligned ourselves with the provincial position, which is that a mask, a cloth mask, that is, would actually assist an individual from safeguarding other individuals, in the sense that if the individual was infectious, then it is less likely that another individual would get it from them. And it's generally recommended if you can't keep the physical distance of 2 meters. So for example, when one may go grocery shopping, if one feels that one's going to be very close to other individuals, then to protect those individuals, not necessarily ourselves, but to protect those individuals, a cloth mask is regarded as being a reasonable precaution. However, we have been looking at this a little more closely, and we thought that maybe it is important for some modeling studies to be done to look at the impact that cloth masks might have. And we have been in touch with some researchers who haven't yet published their information, but the information seems to suggest that if everybody were to wear a cloth mask, then that would contribute to a reduction in the cases, particularly when we move over to the time when physical distancing restrictions are being lifted. Now, we have yet to study that particular study, and a number of people would have to weigh in here, and we would generally be aligned with the provincial position on this. The provincial position at the moment is one of um, saying that basically if you keep your distance, then you should probably be fine. But if you just can't keep your distance, then you could wear a cloth mask. We sometimes worry that wearing a cloth mask may result in an individual touching the face more frequently and maybe having a false sense of security and maybe lapsing with respect to other hygiene measures, which are really washing your hands frequently, disinfecting surfaces. So we don't exactly know at this point in time what the benefit of wearing cloth masks is. But as you correctly said, at the federal level, the chief public health officer has said that it's permissive for individuals to wear cloth masks if they cannot keep the 2-meter distance.
Okay, thank you. The next question comes from Olivia, and Olivia's asking, why is there such a large number of under investigation cases in the status column? How do we not know the status of these individuals and whether they are self-isolating or hospitalized? I understand not knowing where they maybe have acquired, but the status should be known and tracked for the safety of the community.
Thank you. So again, this comes back to the information system. We have been inundated, with the cases and with the outbreaks that we've had. So we've had to constantly shift our resources to address the priorities that we saw as being the most important, including data entry in the areas that really, really mattered for us. So it's only in the last few days that you have seen a concentrated effort in terms of moving that data back into the dates of onset and into the appropriate classifications. We have always known who has been hospitalized. We have never let this necessarily impede our ability to manage the cases or the contexts, or for that matter, the outbreaks. However, it has interfered a little bit with our intelligence with respect to where this whole outbreak is going. And as we get to the point where we are flattening the curve as it is that much more important for us to have all this information. And so there's a concerted effort at this point to put in that information into the, to draw that information from the IFIS. Well, first it has to be put into the integrated public health information system, and then to be drawn from that to be able to show up in our curves.
And Dr. Kurji, if I understand it correctly, our system in York Region feeds into the provincial system. And so there's always going to be a bit of a lag there. Is that correct?
So we try to ensure that there is no lag with respect to us feeding the information into the provincial system. However, there are challenges with respect to having that information extracted to create our own graphs and the interactive dashboards that you see. We have been a leader with respect to keeping everything as transparent as possible. But unfortunately, there's a lot of data that we have that we cannot necessarily keep onto the web page, largely because that data is not totally stable. And you have to ensure that your data is fairly stable before we can actually make it available on the website. So our challenges on the information technology side are huge and evolving as well. Every day there is a new challenge, and so the priorities have to be constantly shifted in order to be addressing the most pressing requirements.
Yeah, okay. A question is coming in from someone in our seniors community. I'm a senior with a cardiovascular problem and considered in the high risk category. I've been practicing self-isolation for the past 4 weeks since I returned from overseas. Can I now go and do my own grocery shopping and take the necessary precautions?
So one of the things that we have found in York Region is that when we look at the COVID-19 cases, those that may be over the age of 70 tend to have a mortality rate of close to 20%. It's about 17%. So that really translates into 1 out of every 5 individuals who gets COVID-19 dies in York Region. And if you were to go to a higher age group, like 85 or so and above, the figure actually, unfortunately, goes up to almost like 1 in 4 individuals. Now, these figures tend to vary depending on the numbers that we accumulate. But that having been said, it is risky for an individual over the age of 70 to contract COVID-19. So our advice has been stay at home as much as you can. Try and get your neighbors, try and get your family members to get something for you. But when they do come home, make sure that they're keeping the distance. And if possible, try and shop using online services.
Great. Okay, thank you. I'm going to take you off the hot seat, Dr. Kurji, for a second and put our CAO on the hot seat, Rob Adams. This question is from Cindy. Once we flatten the curve and we get the green light to reopen, where will we be able to receive the most up-to-date information for Stouffville small businesses? I realize it will be in phases with some restrictions.
Thank you, Mr. Mayor. Excellent question, Cindy, and glad to provide the answer. We have 2 points of contact to provide information, and we'll certainly be guided by Dr. Kurji, Public Health, and the provincial government as they announce the phase-in at some point and what that phase-in looks like. The municipality will follow those guidelines and ensure our small businesses follow those guidelines. We'll be providing that information to our small businesses through our website, which is the townofws.ca/COVID-19. As well, the information will be provided on our l4a.ca, which is our new website we've launched, as the mayor spoke about, to try to promote local businesses and the local economy. So both those locations, you'll be able to find that information when the phase-in is announced, and we'll provide current information to the local community. As well, we have ongoing meetings with the local Chamber of Commerce and the Downtown Working Group to make sure that we're notifying those organizations so that we're in sync with them. We're working very collaboratively with all our partners in the community, including the Chamber and the Downtown Working Group, and we'll be communicating with them the plans as the phase-in happens.
Great, Rob. Thank you very much. One more question that was sent in, Dr. Kurji, from Leslie. Many people who get coronavirus have mild or no symptoms. Is there a way to test if you have had it without knowing? Or do you feel it's better to be unaware so people are more cautious?
Thank you, Mayor. I think that is a great question. Unfortunately, we are not at the stage where serological testing is available. When serological testing does become available, then you would be able to know whether you actually had been infected previously. So that would be the appropriate time. However, for those folks that are currently exhibiting COVID-19 type symptoms, and I must stress that these symptoms can be mild symptoms like a sore throat, runny nose, headaches, diarrhea, and muscle pain, possibly fever, cough, and shortness of breath. We are urging that those individuals self-isolate themselves. They get their close contacts to self-isolate, and then they seek out the assessment centers in the region. These assessment centers are located at the 3 hospitals, South Lake, Markham-Stouffville Hospital, and Mackenzie Health. Each of them have got slightly different processes, but ensure that you are assessed at those assessment centers, and most likely the physicians there will get you tested. And it's important that you get tested because many of the individuals that we see presenting to hospitals in serious condition haven't actually been tested. So it's important for somebody to know their diagnosis, because should their condition deteriorate, then they can call 911 and avoid very serious consequences otherwise. So, and also from our particular perspective, we can then, ensure that their contacts have rings put around them, and so the community doesn't get exposed. And maybe if I could take a moment perhaps to explain something further, Mayor?
Please, absolutely.
So the strategies that we use are threefold. The first one is called the containment strategy. What this entails is identifying cases, and then from those cases, identifying their close contacts, and then putting rings around those individuals, in other words, pushing them into self-isolation. That way, we are preventing the community from getting exposed to those individuals and preventing new cases from arising. Every new case that we prevent results in 100 new cases down the road that we've prevented. So at least in a month's time, that is. The other strategy here is outbreak control. So this is all part of what we call the containment strategy. Then the second component of the strategy is testing. And we'd like to push people to go to the assessment centers and get tested. That way, it fits in with respect to the intelligence we require to identify the cases and the contacts. The testing at the homes is also being aggressively followed, with the Premier wishing that every resident and every staff member at the homes gets tested. We're aggressively pursuing that as well. The third strategy is the one where we depend on the community to do the physical distancing. And this involves the closure of schools and non-essential businesses, as well as the physical distancing processes that we put in place, including staying at home as much as possible. So with everybody's help, with these three strategies, we've been successful at being able to get some control over this outbreak. And I think at this point, we have pretty good control over the community's outbreak, but we're still struggling with some of the homes in York Region with respect to outbreaks there. And we hope that we'll get those under control soon as well. Thank you.
Thank you. Two follow-up questions on what you said. Can you just define what an outbreak is? I think many residents in Stouffville were concerned when Buckingham Manor appeared on the list on the public health website. And then also just a follow-up to testing, because there was some confusion earlier this week, and certainly I was a little confused around testing, which you helped me with, Dr. Kurji, which I'm very thankful for. Just in terms of, if someone goes through the online assessment tool, they feel like they're showing symptoms, they go to an assessment center, it hasn't always been a guarantee that they're going to be tested. And I think things have certainly changed over the last number of weeks with the availability of testing. I know about 3 weeks ago, there was just a focus on healthcare workers and frontline workers. So can you just speak a little bit about how testing has evolved and just if someone is showing symptoms, what they can expect at an assessment center?
Sure. Thank you, Mayor. So let me start out with the first question, which is about outbreaks. So currently, even when we have one case of COVID-19, whether in a staff member or in a resident, we consider the home to be in an outbreak mode. And that may seem to be a little severe, but those are the learnings from places like British Columbia, where they enable measures to be put in much faster, and therefore potentially to have better outcomes. Now, many times we may have respiratory outbreaks that are not COVID-19 outbreaks, but we regard those as being pre-COVID-19 outbreaks, as many of those get converted into COVID-19 outbreaks. There are lots of measures that we put in terms of public health, as we control these outbreaks. And we partner with our hospitals and with EMS to ensure that we have appropriate testing in place. We make sure that there are infection prevention and control measures that are in place. And there are other issues, often staffing shortages, that have also got to be addressed with our LIN partners. So we are working very closely with all those partners with a view to managing all the issues that arise in a given home when it goes into an outbreak situation. Unfortunately, the people living in these homes are the most vulnerable citizens and therefore are much more likely to die as a result of the infection getting into these homes. So they are our number one priority in terms of saving lives. Now, coming back to your second question with respect to testing, in the very beginning, there was a great shortage of testing resources. And you may recollect that the provincial labs were backlogged with some 10,000 tests. And so the hospital assessment centers had to follow what was the provincial guidelines, which were only healthcare workers, only those folks that work in long-term care institutions, those with serious comorbidities, et cetera, et cetera. So the normal individual who probably didn't fit into these categories ended up not necessarily getting tested. However, once we saw that the backlog had actually been handled by the province, we got together with we regularly speak to each other. And so the hospital presidents and myself decided that we would expand the testing to the hotspots, the residents in the hotspots in York region. And then slowly and slowly, we've eased those restrictions so that basically anyone in York region who has symptoms of COVID-19 would certainly get assessed and most likely will get tested.
Okay, great, thank you. Those are the questions that were submitted beforehand. So I'm going to come to some members of council, and I believe Councillor Upton has a question for you, Dr. Kurji.
Sure.
I do.
Rick, your mic, I think you're muted.
On mute now. How's that?
There you go.
Sorry about that. I kept hitting and it wasn't working. Thank you, Mr. Mayor. And thank you so much, Doctor, for giving us your time. I'm sure at this time of night, it's your personal time, so we truly appreciate it. One question I have that one of the residents asked me to ask is, looking at the history that we've gone through with these pandemics and with our new technology, what is the estimated time to have a vaccine?
Thank you, Councillor Upton, for that question. The best that I seem to be hearing is a time frame of around a year. Now, if we are a little faster than that, then you would probably make it to about 9 months. But we're still looking at quite a long time. So the difficulty is going to be, I think that as soon as we get the cases down, the numbers of cases down, I don't think that we will ever get them to zero. But as soon as we get them down to maybe a few within York region, so maybe 5 or 6 a day, we would need to we could potentially shift our strategies to just doing the case and contact management, as well as ensuring that people have access to testing in a liberalized way, so that we are catching any new cases quickly. And then we could potentially relax the physical distancing strategy. So that would mean opening up and easing, the opening up of society so that we can get back to a new normal. But these decisions would have to be made essentially at levels above me, meaning at the provincial levels, and they would need to be done with a lot of thought in mind, given that either the province is at various stages in terms of its outbreaks at different places.
Councillor Upton, do you have a follow-up or are you good? I think we lost your audio.
There we go. Someone's muting me. I don't know how they're doing that, but anyway, no, I appreciate that. The one other question I have, and then I'll be done with it, is that once the restrictions are lifted, what is the expectation with the second wave? This is obviously a concern, and is there any history on that?
Thank you again for that question as well. And that again, usually a second wave would be expected to be coming, probably in about 6 months' time or so. And we're doing some further research in terms of, figuring out, when can we expect one. But most people are saying the fall or the winter of next year. And some folks are saying that it's going to be particularly bad because, you usually have the influenza season as well there. So a second wave normally would be expected to occur. However, I don't think that if we are really well prepared, I don't think that we may necessarily be hit that hard with it if we manage to, as it were, contain these cases very quickly on, and with a lot of help from everybody else in terms of the testing being, quite liberal, and expecting everyone, as they have currently done, to be pursuing all those hygienic measures, hand hygiene, making sure washing hands frequently, not touching one's faces. In other words, doing everything possible, disinfecting surfaces to break the chains of transmission. And I think given the fact that we have already been through the first phase, and we have been well educated with respect to how to prevent this, hopefully we'll do much better in the second phase.
Great. Thank you, Dr. Kurji. Okay, we're Councillor Smith. I believe you have a question. You can turn your mic on and no? Okay, let's go to Councillor Bartley.
No, I'm there. Okay, now?
Oh,
Okay,
there you are, Councillor Smith.
I needed you to unmute. Actually, I have two questions that have been sent to me, and I will paraphrase one of them particular. And Dr. Kurji, you did talk somewhat about masks and wearing masks in public. And the question that was sent to me was, why not make it compulsory to always have to wear a mask in public, or in a public place?
So thank you for that question, Councillor. So there are many disadvantages to wearing masks. The main ones being the fact that one may be touching one's face quite often. So what happens is the virus gets into us when we've touched surfaces that may be contaminated, and then we touch our mucous membranes, which are usually of the eyes, in the nose, or in the mouth. So by adjusting our masks every now and again, we are actually touching our faces, and this is a real disadvantage. And this is irrespective of what sort of mask one is wearing, whether it's a surgical mask or a cloth mask. So the general advice has been not to go there, but science is shifting and science is evolving, and we have scientific advisory committees at the federal level who then advise the provinces. So we are open to evolving science, and if we feel that this is something that we need to do, then I think you will see changes in recommendations then.
Thank you. Thank you. The second question, if I could, Mr. Mayor?
Absolutely, go ahead.
Okay, then you alluded to, Dr. Kurji, perhaps different levels of government being involved. So for Stouffville citizens, who is really the ultimate authority regarding COVID-19? The federal or the provincial or the regional municipal? Whose orders do we follow? I know we get through you, but are they federal that are coming to you? But the question is really, who's the ultimate authority? That's the question that was sent to me.
Thank you. So the way the public health system is organized is we work as a system altogether. So you have the World Health Organization, dealing with Public Health Agency of Canada, which is at the federal level. who then have their pipelines to the provincial bodies, right? You have the chief medical officers of health of the different provinces, and they meet very regularly with the Public Health Agency of Canada and the chief public health officer. And the chief medical officer of health has regular conference calls with us and provides us at the local level, which is the regional municipality of York, public health, so York Region Public Health, with all the appropriate guidelines and guidance. And we are kind of accountable not only to York Region Council, which is in fact of a Board of Health, but we are also kind of accountable to the Ministry of Health and the Chief Medical Officer of Health. So that's basically how the guidance flows. And at the local level, the Medical Officer of Health has the power to, has quite extensive powers, which are used with very judiciously and after a lot of consultation. But in terms of advice, that is usually advice that is aligned with the advice at the provincial level.
Dr. Kurji, thank you. And Mr. Mayor, they were the two questions I have. So Dr. Kurji, thank you for your time tonight. I certainly appreciate it.
You're most
By the
welcome.
residents. Thank you, Mr.
Councillor
Mayor.
Smith. Councillor Bartley?
Thank you, Your Worship. And Dr. Kurji, thank you very much. I had 3 questions for you, and each one of those questions got answered this evening. So I appreciate your time and everything you've been doing for York Region, sir. Thank you.
You're welcome. Thank you.
Thank you. Councillor Sherban? I think I saw Sue.
Hi, can you hear me now?
Yeah, we got you.
Okay, thank you. Thank you, Mr. Mayor, and thank you, Dr. Kurji. My concern is in the long-term care, and I know you've answered some of our questions, but once this COVID first round is through, who do you feel or how do you feel we should go forward in regards to a independent investigation on how long-term care centers are managed and under what regulation? In Ontario, we are the largest number of deaths in our long-term care, and it is a tragedy. And is there something that you have heard or how we should move forward to make sure this doesn't happen and happen in a second wave?
Thank you, Councillor, for that question. Actually, our experience has been quite different in that long-term care homes and retirement homes have had a strong culture of infection prevention and control. And we have actually been instrumental in terms of ensuring that they continue practicing things at the standards that we like them to. They are generally very well versed with respect to control of outbreaks, as they have had different sorts of outbreaks in the past. And what we have found, though, is that as soon as you get down to other places of congregate living, such as group homes or homes for special care or lodging homes, or for that matter, shelters, that's where we seem to be encountering bigger issues, because they haven't had the same culture of infection prevention and control. So there's a lot more education that has to be done there, and a lot more hand-holding that has to be done there. And this is where, you know, we have started out a lot of all this proactively before COVID-19 came about, but it wasn't enough. And we've just recently had webinars with the group homes. We have partnerships with the local hospitals so that they can go into the homes and provide infection prevention control education before an outbreak starts, right? And through these partnerships with the hospitals, EMS, and the LINs, we are able to divide up some work with respect to testing, with respect to providing infection prevention control advice, with respect to staffing shortages and how these are going to be dealt with. So I think the partnerships are an excellent way of being able to bring resources to this sector. But in addition to that, the province has recognized that they do need income supports. And so you have seen funding for long-term care homes so that you don't actually get the rather poorly paid part-time workers working in several homes, but being concentrated in one home at a time. And the same thing with respect to the group homes and the other, spaces for congregate living. Only today, I think the province announced that the same sort of standards that were being used for the long-term care homes would now start being applied to those other places. Now, we in York Region actually jumped the gun, and we required some of those standards to already apply to those settings. And we recommended that some of the other standards be followed. We didn't require them because we were waiting for the province to take some action there, as to require certain things when you don't have income supports in place is difficult for folks to follow. So I hope I've answered some of what you asked.
Yeah, well, I guess my concern is when this first outbreak and was recognized that it was happening in the long-term care homes, there was right out in the beginning a statement that there was only a handful that had been, I guess, under the scrutiny of the province to go out and do independent site visits. And site visits have been lacking in those long-term homes, and in the other sorts of multi-living. And I guess I just worry that after this, we get over the curve and, things settle down, that we'll slide back into our old ways again and, not have eyes on that. So I'm hoping that either an independent review that will come out with solid practices and policies that have to be imposed in these long-term care homes to sustain going forward, not just when we're, under a time of this nature, that it is really very sad that we've come to this, and we didn't do our due diligence prior to this happening to our most vulnerable. So, I guess in your capacity representing us at the region, and through this experience, that become a focus of your department to make sure that it is followed through with, and whether it's that independent body that does the review that we ask for, or that at least your collaboration with your colleagues, you call for it and that it gets done. I've, had the fortune of having our, as all of us, our moms and dads being in those. Mine have passed, but I feel for those that, are in isolation now and what is going on there. And I just feel that we've dropped the ball. So
sure. So thank you, Councillor Sherban. What I would say is that there are different folks that are responsible for this. There is the Ministry of Long-Term Care, who does have inspectors, and I believe they transitioned to a risk-based approach rather than inspecting every home. So I'm sure that that particular approach will come under some scrutiny. However, we in York Region Public Health don't have to go in and do audits, but we have actually been doing audits. In 2019, out of the 28 long-term care homes that we have, I believe we have audited 25 of them for infection prevention and control. So we've gone a little bit beyond what we have been mandated to do, largely because we very strongly believe in prevention and putting in place safeguards before anything goes wrong.
Well, I thank you for that good work, because that, is key, and I'm glad that you have had your eye on the ball. One other quick question. Our youth under 12 don't seem to, the infection of this virus has not seemed to, at this point, I guess, attacked that younger group. Very few, very low. Why do you think that is? And what do you think will happen when they go back to school? Have we thought of any preventions in place? Or I know that's not our role, but I know that is a question that we get, even though we're municipal, constantly about school board issues and hospital issues, which are both outside of our jurisdiction. But it's good to know that somebody's got, looking at that.
So thank you again, Councillor Sherburn. Whilst the numbers that may be in those age groups are small, we've even had a 9-month-old baby who came down with COVID-19. The issue of, children does worry us because, unfortunately, in other respiratory diseases, they happen to be great carriers of the viruses. For example, influenza, and they're the ones who usually transmit it to parents and others in the household. And so that is certainly something that will be a great worry for us, but it is our hope that if we can bring down the numbers in York Region to just a few, and we keep that well under wraps, then you won't actually have this circulating virus in the community. Then it is with that hope that we would be able to prevent anyone from being able to spread it in the schools.
In the schools. Yeah, because for some reason it's a very low number, and it just seems strange that, as you said, because normally they're the ones that are the spreaders and bring it home. So I worry, when they do go back to school, how this may change quickly, or how it may change quickly. Thank you. Those are all my questions, and thank you for taking this extra time and speaking to us and our community.
You're welcome.
Thank you, Sue. Dr. Kurji, just a follow-up to one of Councillor Sherburne's questions. There's been a lot of discussion in the news around long-term care centers with PSWs working at multiple homes and questioning whether or not they have actually been a carrier that's taken it from one home to another. Would that be something, that's something I never actually thought about. And I certainly, I'm not making judgment on a healthcare worker's need to work for two organizations, but would that be something that would be a recommendation? Certainly the province has now stopped that. But would that be something from your opinion that actually would be a good decision, that you work with one agency or one home?
Yes, Mayor Lovett, it's obviously a very complicated socioeconomic issue as well, because apparently these personal service workers don't get paid much. And, in order to be able to support their own families, they usually have to work at other settings.
Yeah.
And so unless there are income supports, which currently the ministry has put in place for long-term care homes and now for the other homes, it would be a very difficult implementation to be sure that, we were able to implement this in our long-term care homes. That being said, I should also say that our personal service workers work extremely hard, generally very dedicated and very conscientious, and have the interest of their residents at heart. So the times when we have seen it get introduced from one home to another has been largely without them realizing, because remember, for the longest time, we didn't think that this virus was transmitted prior to somebody having symptoms. But now the science tells us that it's transmissible 2 days prior to symptoms starting. And usually we find that you've had a worker who comes down with symptoms, may even have been perhaps on a Saturday, but then they've actually worked on Friday and Thursday. And that's where the transmission has occurred. So it's not out of deliberate negligence of the symptoms, per se, but it's unwittingly that they've introduced transmission from one place to another.
Yeah, well, it goes without saying that, our healthcare workers and our frontline workers are our heroes through pandemics like this, and we owe them a deep gratitude for for really what they're doing. And I don't know if anyone caught the story on the National a couple of days ago. It was at Markham-Stouffville Hospital, but kind of having an inside view of what's going on down there during this pandemic is not only heartbreaking, but it certainly makes you proud of who we have working on our behalf and contending for all of us, not just those that are patients at the hospital. So, okay, we're actually going to open the lines out to a number of people that are on the call with us. And if I can get the moderator to unmute Bill Lukwich. Bill has a question for you, Dr. Kurji.
Hi, Dr. Kurji.
Hello.
I think you've answered a number of the questions that I did have and at least jotted down. I think based on mostly, I guess, watching the media, it appeared that antibody testing is something that certainly in New York City is starting to, in its infancy, determine that quite a few more people than, of course, have been tested, in fact, have the antibodies to be able to fight the virus. So the timing on when you thought the antibody might be, in fact, becoming available within York region, and then specifically, because I didn't realize that there was a dashboard, do we have a specific number of people in Whitchurch-Stouffville that have been tested for the virus? And what is that, in fact, showing in terms of a percentage, or is it just broken down by York region? So kind of a double-edged question, and thank you again. It's been very informative.
Sure. Thank you very much for those questions. So on the first question with respect to the antibody testing, we are very much dependent on Health Canada approving any particular techniques because you see many of these technologies have to be tested and approved appropriately because many of them don't actually necessarily deliver on the goods as they promise. So for us in York region, we would be very dependent on the guidance we receive from the province as well with respect to the utilization of these serological testing techniques. And I still think that they are at least a few weeks away before they get introduced in any major way. So that's the serological testing question. With respect to the other question about how many folks in Whitchurch-Stouffville have been tested, unfortunately, we don't have that statistic. What we do have is a statistic which is based on numbers per 100,000 that we think may be infected in Whitchurch-Stouffville, or for that matter, in any other municipality. And those rates are available through our dashboard. But those rates I would interpret with some caution, because those are based on those folks that have already been tested and the populations in those areas. The folks that have already been tested are not exactly the same as the folks that might still be in the community. And this is why we are urging people to actually avail themselves of the testing. And we are trying to refine our epidemiological techniques so that we can come up with the true prevalence of the COVID-19 in every community.
Thank you.
Okay, thank you. The next question is from Colleen Taylor. If we can get the moderator to unmute Colleen.
Hi, thank you, Mayor Levitt and Council, and thank you to our town clerk for helping to organize. Dr. Kurji, I have two questions for you. If I could, I'll ask one at a time because they're slightly different topics. The first question is about grocery shopping. Right now, I have this big process where I bring the groceries into the car, I put them in the trunk, and when I arrive home, I wash them as I remove them from the trunk and put them into clean bags. And what I'm wondering is that overkill, or should we be disinfecting our groceries before bringing them into the home?
So thank you for that question. My sense would be not to feel too anxious about the groceries, and maybe to do the usual things, which would normally be washing the veggies, etc. And certainly wash your hands before you go into grocery store. Wash your hands again when you come out. We haven't had any cases that have arisen as a result of us knowing for sure that it was due to exposure to any groceries that somebody may have handled. So that would be my sense right now, as sometimes there are things that we think are logical to do, but they are not necessarily born with any evidence that that was the right thing to have done. So certainly we need to take appropriate precautions, but not to go overboard with that.
Perfect, thank you. And the other question I had is, there's been a lot in the news about various frontline workers, predominantly healthcare workers, but some of our other frontline workers that have been struggling to get access to proper PPE. And I'm wondering if in York Region, specifically in Stouffville, is that still a struggle? Or do you feel that our frontline workers now have the appropriate access to the appropriate PPE?
Thank you for that question. I would have said that that was a very, very valid concern 2-3 weeks ago. But since then, the ministry has opened up a number of pipelines to the ministry stockpile, and they have received, ample amounts of PPE for the, shall we say, for the long-term care homes, for the hospitals, for all the homes now. At one point, and I think Mayor Lovett may remember in my presentation to council, I had said that we were having tremendous struggles with respect to PPE availability. And so that has eased tremendously. I wouldn't say that it is totally adequate as yet, because I'm sure the province has its challenges. But for us on the ground, the pipelines have opened up. We in York Region had been very fortunate that following SARS, we, in terms of the York Region Public Health, maintained a stockpile, which for 17 years, and we kept on rotating it so that it was current. And that stockpile really assisted us at bailing out our EMS, bailing out our homes, whether they be long-term care homes or group homes, and bailing us out as well, and individuals who definitely needed that. So, thanks to that advanced planning, we were able to get over the crunch period until such time as reinforcements arrived. Thanks.
That's great, Dr. Kurji. Thank you very much, everyone, for your time.
Thank you, Colleen. If we can get the moderator to unmute Bruce Black, please.
Yeah.
Bruce, are you there?
Yeah. Can you hear me okay?
Yep.
The question is, can you explain to us zoonosis? It seems to me to be the general genesis of most viruses and diseases. And would you consider less consumption of animals?
Thank you for that question. You have seen over the last few years that zoonosis, which is really the area of diseases arising from many animal factors, or so for that matter, you've got West Nile virus, you've got Lyme disease, you've had now you had SARS earlier on, and now you've got this particular virus, which is really known as SARS-CoV virus 2. It certainly is a growing problem with respect to emerging diseases. We've also had MERS-CoV virus, which is the Middle Eastern respiratory virus, which I know you haven't heard about too much nowadays, but at one time we had a very close call in York Region when somebody who had treated, as an anesthetist who had treated an individual with MERS-CoV virus in a Middle Eastern country was visiting York Region. And it was then discovered that the case that he treated was positive for MERS-CoV virus. And from our experience with SARS, we do know that often the anesthetists, if they're not properly protected, may actually contract it. So we might have had the first case of MERS-CoV virus in North America. However, so all of these conditions do pose a lot of threats, but they're not necessarily associated with not eating animals. I think if animals are, handled hygienically, as happens in our slaughterhouses, I don't think that poses much of a risk.
Thank you. Thank you for your input. Appreciate it.
Thank you, Bruce, for your question. Next, we have Terry Colson. If we get the moderator to unmute Terry. Terry, are you there? Terry?
Hi.
There you go.
Hi, sorry about that.
No, what's okay? We got you now.
I've read that the virus can only remain airborne for a very short period of time. So does that mean unless you're in direct contact with someone who's sneezing and coughing, that you're more likely to pick it up via surface contact? And also, how long can the virus survive on certain surfaces?
Thank you, Terry. You're quite right. Because the virus tends to be spread through droplets, and droplets tend not to actually be projected more than perhaps a meter most of the time. But if somebody were to sneeze, then it's likely to go beyond that. And so we generally advocate a 2-meter distance. But if somebody isn't coughing, sneezing, singing, or talking very loudly, and isn't throwing out any droplets, then you're not actually going to be getting those droplets reach you. So the only way that you would normally get the virus would be if you touch anything where the droplets have landed. And if you happen to touch that, and then your hand touches your face and in the mucous membranes of your eyes, nose, or mouth, that's how the virus enters into our bodies. And this is why we keep on emphasizing that we need to know the science behind how the virus is transmitted so that we can break those chains of transmission, such as by washing our hands frequently, so then you're getting rid of the virus on your hands. If you inadvertently touch your face, by the way, most of us would be touching our faces anything from 10, 12 times an hour to maybe on the low side, maybe 20, 25 times a day. So, and we do this unconsciously. So by having frequent washing of our hands, we're less likely to be able to transmit anything into our mucous membranes.
Okay, thank you. And what data is there to suggest the length, how long the virus can survive on certain surfaces?
Sure, thank you for that reminder. Generally speaking, it seems the time frame is usually from a few hours to about 9 or 12 hours, but this isn't totally confirmed. But I would think that most of the time you would probably be looking at a few hours.
Okay, thank you very much.
Great, thank you so much, Terry. And I want to thank everyone for their questions this evening. We have no more questions from the public. And Dr. Kurji, I want to thank you for your leadership in the region and overseeing public health and your staff that are working around the clock. These are crazy days that we're in right now. And I know with everything evolving as quickly as they are, there's lots of opportunity to unfairly criticize. And I just want to say on behalf of our council here in Whitchurch-Stouffville, we're so thankful for you and your leadership during this pandemic. And when there's not a pandemic, we're thankful for your leadership too. But certainly in times like this, we're very grateful for your leadership. And we're certainly grateful for all our healthcare workers. We have many members of our community that live in Whitchurch-Stouffville that are PSWs and doctors and nurses and EMS paramedics and firefighters and everyone that is fighting on our behalf. We are indebted to you. We're thankful for you. And we will keep sending you our best wishes and prayers that this ends quickly and you will stay safe as you fight this for us. So ladies and gentlemen, that will be the end of this evening's virtual town hall. I want to thank everyone for joining and those that have been watching on Facebook. And please let us know if this was informative. Hopefully we won't have the need to do it again. And because I I personally am looking at some data and hoping that we're on the cusp of the downward curve of this. And but again, thank you, Dr. Kurji, for your time and taking the hour and a bit to be with us. Okay, everyone, be well and be safe and take care. Thanks so much. Good night, everyone.